What if I told you that there is a hidden truth that most seniors will never hear from their doctors? That millions of us line up for routine health checkups every year, believing we are staying safe, when in fact, we might be doing the opposite. What if some of those very tests, the common, everyday ones your doctor says you need, could actually be pushing you closer to unnecessary surgery, a debilitating stroke, or even a life-altering cancer diagnosis? This isn't a conspiracy theory. New studies reveal that up to 37% of common medical tests in seniors lead to a cascade of unnecessary treatments, dangerous complications, or lifelong side effects. And today, we are uncovering the 5 most dangerous checkups you should seriously question after the age of 70. The truth has been buried in the science, and we're about to dig it up. Before we begin, we want to hear from you. Let us know in the comments below where you're watching from and what your own experience has been. Do you think seniors are being tested too much? We are reading and replying to every single comment with personalized tips and advice. And please, don't forget to like this video and subscribe to our channel for more life-saving information like this. Now, without any further ado, let's talk about the first test on our list, one that looks completely harmless, but could quietly ruin your quality of life. Number 5, the routine bone density scan. It sounds so simple, so proactive, doesn't it? A quick, painless scan, no needles involved, and you walk out with a piece of paper that tells you whether your bones are at risk for future fractures. It seems like the responsible thing to do, but here's what no one ever tells you. Past the age of 70, a routine bone density scan can often create far more fear than actual benefit. This scan, which is officially called a DEXA scan, measures the mineral density of your bones. It's primarily used to detect osteoporosis, a condition of brittle bones. But here is the crucial context that is so often missed in older adults, especially women. The results of these scans almost always come back showing some degree of lower bone density, even when there's no real, immediate danger of a fracture. That's because losing some bone mass is a natural, normal part of the aging process. Just like getting wrinkles in your skin or silver threads in your hair. It happens to everyone, and yet, armed with this number on a page, many seniors are immediately pushed into taking powerful medications like bisphosphonates. These drugs are supposed to strengthen bones, but they often come with a host of serious, and sometimes debilitating, side effects, including a rare but terrifying condition called osteonecrosis of the jaw, where the jawbone literally starts to die, as well as severe esophageal irritation and digestive distress. Now, here's the problem. Multiple studies have shown that for older adults with only mild bone loss, taking these medications has little to no impact on their actual fracture rates. A significant study published in the Journal of the American Geriatric Society followed over 1.20 women over the age of 70 and found that after 5 years, bisphosphonates reduced their overall fracture risk by only 0.3%. That's not nothing, but it's a far cry from being a life-saving intervention. Instead, Those same women were far more likely to suffer from the medication's side effects. Let me tell you about Rose, a vibrant, 76-year-old retired piano teacher who was referred for a DEXA scan after her annual checkup. She had never had a fall, had no pain, and walked every single day. Her scan, predictably, came back showing osteopenia, which is the mild, often age-appropriate, reduction in bone density, not full-blown osteoporosis. Her doctor immediately started her on a bisphosphonate drug. 3 months in, Rose developed severe acid reflux and a deep, aching jaw pain. By the time we saw her, she hadn't been able to play her beloved piano in weeks because of the discomfort. We took her off the medication and instead started her on a simple, natural regimen of vitamin D gentle weight-bearing exercises using resistance bands, and a diet rich in calcium from whole foods like sardines and leafy greens. 1 year later, she was back to performing recitals, with stronger legs, better balance, and 0 fractures. A short scan may seem like a smart move, but for people over 70 who aren't actively falling or breaking bones, the far better and safer option is lifestyle, strength training, balance exercises, proper nutrition, and treating any underlying vitamin D deficiency have been conclusively shown to reduce fracture risk by over 20%. According to a 2022 study in Osteoporosis International. Please, do not let a number on a screen scare you into a treatment you may not actually need. But there's one scan on our list that can lead to something even scarier than jaw pain. It can lead to unnecessary brain surgery. Let's talk about that next. Number 4. A brain MRI for mild memory loss. When seniors begin to feel more forgetful or occasionally confused, the natural, human impulse is fear, a deep, primal fear of dementia, a fear of Alzheimer's disease. And so, doctors, often with the best of intentions, respond to that fear by ordering a brain MRI. But here is the uncomfortable and often unspoken truth. MRIs, which are incredibly detailed scans that show the physical structure of the brain, rarely give patients with mild memory complaints the clear answers they are so desperately hoping for. In fact, most MRIs in people over the age of 70 simply show normal, age-related changes, things like slight brain shrinkage or small, white matter spots that are considered a completely normal part of the aging brain. Much like those wrinkles on our skin. But here's the kicker. Once those harmless spots are seen on a scan, they can trigger a terrifying cascade of fear, which then leads to a battery of further, more invasive tests, and in some tragic cases, even to surgery that may not improve memory at all and can, in fact, make things significantly worse. In 2021, a study published in Neurology Today reviewed over 3.0 MRI scans in patients aged 70 to 85 who had only mild cognitive complaints. A staggering 86% of them showed some form of brain abnormality, but only a tiny 3% of those findings were actually linked to a treatable condition. That means that 97% of those people went through the immense emotional toll of being told, there's something wrong with your brain, when in reality, there likely wasn't. Worse still, nearly 12% of those patients were then sent for highly invasive procedures like spinal taps or even exploratory brain biopsies. All based on these vague, often meaningless, scan results. Take George, a sharp, 74-year-old retired engineer who came into a clinic worried about his forgetfulness. He was still brilliant, but he was misplacing his keys more often and sometimes forgetting names at social gatherings. His doctor sent him for an MRI that showed some of these common white matter changes. George panicked. He became convinced he had early onset dementia. He stopped driving his car. He stopped going to his beloved church. Over the next few months, his world became smaller and smaller, and his anxiety worsened dramatically. But when we reassessed him using a standard cognitive screening test, his score was well within the normal range for his age. We explained to him that those MRI findings were, in fact, age-appropriate. We helped him focus instead on proven lifestyle interventions, like improving his sleep, ensuring proper hydration, and engaging in brain games. Within 3 months, his memory had stabilized, his confidence returned, and he felt like himself again. The truth is, unless there are severe, red flag, neurological symptoms present, like seizures, a sudden and dramatic personality change, or a rapid decline in daily functioning, an expensive and anxiety-inducing MRI is rarely helpful for mild, age-related memory loss. A much better, safer first step is the simple cognitive screening test, which is often just a paper-based exam that a doctor can do in their office to evaluate memory, attention, and problem-solving skills. It's cheap, it's incredibly effective, and it avoids the immense risk of creating unnecessary panic and harm. Now, I need you to brace yourself, because the next test on our list is one that you, or someone you love, has probably had multiple times, without ever questioning it, and there's a very good reason why it holds the number 3 spot on our list of checkups to avoid. Now, I need you to brace yourself, because the next test on our list is one that you, or someone you dearly love, has probably had multiple times, without ever questioning it, and there's a very good reason why it holds the number 3 spot on our list of checkups to avoid. It's the one test that so often leads down a frightening rabbit hole of unnecessary, and often dangerous, heart procedures. Number 3, the routine cardiac stress test. It's one of the most common tests given to seniors who complain of even mild fatigue, occasional chest tightness, or just that vague feeling of not feeling like they used to. The cardiac stress test, which is a procedure that monitors your heart while you're walking on a treadmill or being given medication that chemically simulates exercise, is meant to spot dangerously blocked arteries. But after the age of 70, this test, especially when used on people who don't have any classic, clear-cut signs of heart disease, often does far more harm than good. That's because it can frequently lead to false alarms, triggering a cascade of anxiety and unnecessary invasive heart procedures that carry their own serious risks. The problem lies in its accuracy, or lack thereof. Studies consistently show that in adults over 70, the false positive rate for stress tests, meaning the test says there's a problem when there isn't one, can be as high as 40%. That alarming rate leads directly to follow-up tests like invasive angiograms, and even to unnecessary stent placements or bypass surgeries. In 2017, a major study in the prestigious journal JAMA Cardiology found that more than half of all stents placed after routine stress test referrals were done in patients who experienced no real symptoms or subsequent benefit. And those patients, they saw no improvement in their survival or their quality of life after the procedure. What they did have, however, was significantly higher rates of bleeding, kidney injury from the contrast dyes used, and prolonged, traumatic hospital stays. This is exactly what happened to Raymond, the vibrant 75-year-old retired postman we mentioned earlier. He stayed active by walking every single day. During a checkup, he casually mentioned that he sometimes felt a bit tired on the steeper hills. His doctor, just to be sure, scheduled a stress test. The results came back unclear, so he was sent for a cardiac catheterization, which is an invasive test that inserts a tube into the arteries of your heart to check for blockages. A mild, insignificant narrowing was found, and a stent was placed. But that very night, Raymond had a severe reaction to the contrast dye used during the procedure and developed acute kidney problems. He ended up spending 6 long days in the hospital and needed follow-up care for weeks. And the fatigue, it never changed, because it was never a heart problem to begin with. He was simply an older man who needed better hydration and a bit more rest between meals. If you're over 70 and not experiencing classic cardiac symptoms like chest pain during activity, significant shortness of breath on exertion, or a major drop in energy during light exercise, then a routine stress test may do far more harm than good. A much better and safer option is often a simple resting EKG, which looks at your heart's rhythm while you're still, or even a coronary calcium scan, a low radiation imaging test that can show whether dangerous plaque is actually building up in your arteries. These are safer, simpler, and far less likely to push you into a risky procedure you never needed in the first place. Number 2, the routine colonoscopy. You probably didn't expect this one to be on the list, did you? But the colonoscopy, a procedure that uses the long camera to examine the inside of your colon, is not always a wise choice after age 70. And is almost never recommended as a routine screening after age 75 unless there are specific, concerning symptoms. As we age, the risks associated with the procedure simply go up. The preparation itself is harsh, involving strong laxatives that can cause severe dehydration, dizziness, or even acute kidney issues in older adults. The sedation used during the procedure poses added risks to brain function and cognitive health in seniors. And perhaps most surprisingly, the test itself, while generally safe, can cause serious complications like significant bleeding, a tear in the colon wall, a perforation, or even heart rhythm disturbances during sedation. A landmark 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. The findings were staggering. They found that for every 1.00 routine colonoscopies performed on patients over 75, only 2 lives were potentially saved from colon cancer. But in that same group, over 20 people experienced serious, sometimes life-threatening, complications from the procedure itself. That's a 10-to-1 risk to benefit ratio, a gamble that is simply not worth taking for most. And even when polyps are found, many are small, benign, and so slow-growing that removing them in an older adult can sometimes do more harm than simply leaving them alone. Consider the story of Dana, a 73-year-old grandmother who joyfully ran a small bakery with her daughter. She had 0 symptoms, no bleeding, no changes in her stool, and absolutely no family history of colon cancer. But her new primary doctor, fresh out of residency and following a standard checklist, urged her to get a routine screening colonoscopy. She reluctantly agreed. During the procedure, a small polyp was removed, and she was sent home. That night, she experienced intense abdominal pain and fainted. At the hospital, they discovered a bowel perforation from the procedure. She ended up spending 9 agonizing days in recovery, lost 10 pounds she couldn't afford to lose, and hasn't been the same vibrant person since. When her case was later reviewed, it was found she had already had 2 clean colonoscopies in the years prior. There was absolutely no medical reason to repeat it. The U.S. Preventive Services Task Force, a leading authority, now clearly recommends stopping routine colon cancer screening at age 75 for most people. For those in excellent health between 75 and 85, a stool-based test like the FIT test, a non-invasive fecal test you can do easily in the privacy of your own home, is often a far safer and still effective option. It has no harsh prep, no sedation risks, and still catches most concerning cases. Ask your doctor about these alternatives, because once you're in the routine colonoscopy pipeline, it can be very difficult to get out. And now, we have reached the checkup that is the most overused, the most dangerous, and the most harmful for seniors. And you have almost certainly had it done. Number 1, the annual preventive full-body CT scan. Full-body CT scans, which are sometimes offered as part of expensive executive health packages or as enticing preventive services in private clinics, are masterfully marketed as a futuristic way to catch cancer early. But here is the shocking and frankly terrifying truth. These scans expose your body to a high dose of ionizing radiation. For older adults, especially those over 70, the risk of these scans triggering a cascade of unnecessary follow-ups, painful biopsies, and even life-altering surgeries is incredibly high. And the ultimate irony, there is zero scientific evidence that performing full-body scans on people without any symptoms actually saves lives. Each full-body CT scan delivers between 10 to 20 millisieverts of radiation. To put that in perspective, that is roughly equal to the radiation from 500 chest X-rays. According to a 2023 modeling study published in JAMA Internal Medicine, the dramatic rise in the use of CT scans across the United States may now be responsible for up to 5% of all cancers, putting them on par with daily alcohol consumption as a known cancer-causing factor. That means 1 out of every 20 cancers could potentially be caused by a scan that was supposed to prevent disease. That's not just counterproductive, it's terrifying. The scan can, and often does, detect harmless, age-related nodules, calcifications, or cysts that are simply a normal part of a life well lived. But the moment they are seen on that black and white image, a red flag goes up. More scans inevitably follow, then invasive biopsies, then a storm of panic and anxiety. Let me tell you about Marcus, an active, vibrant 80-year-old who used to teach martial arts to younger seniors. He felt great, but he was convinced to take part in a senior elite checkup at a private clinic. His full-body scan showed a tiny 3 mm lung nodule that immediately set off a chain reaction of medical intervention. He was referred to oncology, sent for a PET scan, and eventually underwent a needle biopsy of his lung. The result, completely benign, but the biopsy itself collapsed part of his lung, leading to hospitalization and a grueling 2-month recovery, all for something that should have been left completely alone. The experts are clear on this. The American College of Radiology explicitly states that full-body CT scans should never be used for general screening in asymptomatic adults. There is no proven benefit, and there is significant potential for profound harm if there are real, concerning symptoms like unexplained weight loss, coughing up blood, or a visible swelling. Then a targeted imaging scan of that specific area makes perfect sense. But scanning your whole body with no specific focus is like searching for treasure in a field with a landmine detector. You might, indeed, find something, but the damage from the process could be far, far worse than what you were trying to avoid. A safer, smarter approach is simply listening to your body. If you feel well, maintain your regular checkups with your primary doctor whom you trust, and only agree to tests that are clearly indicated by genuine symptoms or strong risk factors. Your time, your energy, your peace of mind, and your health are far too valuable to waste on fear-driven screening that could leave you worse off than where you started. So, there you have it, 5 common checkups that may seem helpful on the surface but can actually cause significant harm. Especially once you're past the age of 70, modern medicine is a powerful, life-saving tool, but it's not perfect. And when it comes to your health, sometimes less is truly more. Always be your own best advocate. Always ask your doctor, what happens next if this test finds something? What are the real risks versus the potential benefits for someone my age? If the answer is unclear, or if the risks seem to outweigh the reward, it may be time to pause and get a second opinion. And remember always, real, lasting prevention starts with your lifestyle. Stay active in ways you enjoy. Eat well, sleep deeply, and choose your checkups wisely. Now, we want to hear from you. Your story could be the very thing that empowers someone else to speak up. Have you, or someone you love ever faced complications from a medical test or a treatment that later turned out to be unnecessary? What happened? Please share your experiences and your opinions in the comments below. We read and value every single one. If this video has opened your eyes and empowered you to take more control of your health journey, then we passionately, sincerely invite you to become a vital part of our community. Subscribe now and join our mission to share life-saving, empowering information that challenges the status quo. By subscribing, you are not just getting more videos. You are joining a movement of people who are committed to being their own best health advocates. Click that subscribe button with purpose, and be absolutely certain to ring that notification bell, because you won't want to miss a single one of our upcoming deep dives into the truths that can protect your health and well-being. Thank you so much for watching.